Hello everyone and welcome to another day of high yield USMLE questions. Today we will be talking about cardiology. So we have a 75-year-old female presented to the emergency department because of an episode of left eye vision loss. The episode lasted for about 5 minutes. She also complains of pain and stiffness of the right shoulder and headache for the past 4 months. She is diabetic and hypertensive. Vitally, the patient is stable. Complete blood count shows platelet of 700,000, so that's very high. If it's greater than 450, then you can think about thrombocytosis. So this is thrombocytosis. WBC of 7,000 and hemoglobin of 11. So these are normal. ESR is 80. So remember, HB is a bit low, but not a big deal here. And then ESR is high. ESR is also high. So what is the next best step? Alright, so now this patient is having episode of vision loss, and then also this patient is a female and 75-year-old. So remember, this is a very classic demographic for someone with giant cell arteritis. Old female is a classic demographic for a giant cell arteritis, and this patient has very typical symptoms as well. Episode of vision loss is common, and then you also have this pain and stiffness. This is associated polymyalgia rheumatica. So remember, in polymyalgia rheumatica, what happens is that if this is one joint and there's the other joint, and you have these tendons that are attached to each other, and also these tendons are attaching the muscle to these bones. So this is, for example, the muscle. So what happens here in the polymyalgia rheumatica is that you have inflammation of these tendons. Remember, not the muscle. Muscle is not involved. Inflammation of this and inflammation of the joint. So you have the inflammation of the joint and the tendons, and that is going to cause increased ESR. Usually the patient is just going to present with joint stiffness and pain. And remember, CK here in this case in polymyalgia rheumatica will be normal. So this is to differentiate from myopathies, from the other like the statin myopathy, hypothyroid myopathy. So this is to differentiate from those conditions. So polymyalgia rheumatica, ESR is raised, and you will just have the shoulder stiffness, just like this patient has shoulder stiffness for the past 4 weeks. So this explains the polymyalgia rheumatica. And remember, giant cell arteritis is associated with polymyalgia rheumatica. So, and remember, the CK here in the polymyalgia rheumatica is normal because this muscle is normal. Muscle is not involved in polymyalgia rheumatica. Now, so this patient has the ESR is very significantly raised in this patient, and in giant cell arteritis, as the name indicates, it's an arteritis. And remember, it's an arteritis of the major branches of the aorta and aorta itself. So like this is the aorta. Aorta has these carotid arteries and the subclavian arteries that are coming off of it. So for example, there is inflammation of this aortic layer, there is inflammation of this carotid layer, and also the carotid externally can go to the temporal artery, become the temporal artery inflammation. Remember, hard and tender temporal artery, which you can actually see clinically on the side of the head, can occur. So the pain is usually on the side of the head because of the temporal arteritis. The name indicates usually the temporal artery can be inflamed and tender, and so usually on the side of the head the pain is there, but the pain can be bilateral. And because of these carotid arteries, the central arteries that are going to the brain, they can also one of the arteries that branches off of it is the ophthalmic artery. The ophthalmic artery branches can also be occluded, leading to the vision loss. So remember, these patients are at increased risk for vision loss. So you need immediate steps here, because as soon as you see someone with polymyalgia rheumatica features, with the vision loss, with the headache like here, so that suggests giant cell arteritis. And also on top of it here, they gave the ESR very raised. Now the next step should be high dose glucocorticoids, very high dose glucocorticoids. So the high dose glucocorticoids are important because they are going to be decreasing the risk of immediate of sudden vision loss, severe vision loss, or permanent vision loss. So to prevent permanent vision loss, glucocorticoids high dose should be given. Now, So the other options include plasmapheresis. Wrong answer. Plasmapheresis, usually you can give it, for example, someone with Guillain-Barré syndrome, multiple sclerosis, flare. So those conditions you can give it, but here it's the wrong answer. IVIG, wrong answer. You can give it, for example, thrombocytopenia, those conditions. Now remember, also gave the platelets here are 700,000. Why? Because remember, during the inflammatory conditions like here, giant cell arteritis, the platelets usually rise. Platelets usually rise. So you can say during the inflammation, platelets rise. So then aspirin, you may think that aspirin would be the right option here because this patient is diabetic, hypertensive. Remember, hypertension is the #1 risk factor for stroke. And you may think that this vision loss may be considered a stroke. So let's just give her the aspirin. But remember, the other features like the headache, like the right shoulder pain and stiffness and increased ESR, much more likely going towards the giant cell arteritis. So that's why aspirin here, wrong answer. Heparin, again, you might think that there is a thrombosis going on, so let's just give it give anticoagulant. But remember, there is no such thing going on. ESR is rate. This is inflammation. Inflammation may cause the narrowing, and that is causing the eye vision loss. So remember, there is no risk of thrombosis in patients with giant cell arteritis. They may have thrombosis, but remember, the heparin or anticoagulants have not been shown to actually improve outcomes of those thromboses that occurs in giant cell arteritis. So this is the wrong answer. A much more better step is high dose steroid. This is the right answer, and this is gonna save the patient's vision. So hope this video was helpful, and if anyone requires tutoring, they can email me here. Also, if this channel helps you, links will be in the description. You can support the channel there. Thank you for watching.